So this year at ASCO, in plenary session, a really important and crucial trial and results were presented for upper GI cancers, meaning that ESOPIC trial results were presented. This was an academic independent trial investigating the differences between FLOT, meaning perioperative chemotherapy, versus neoadjuvant chemoradiotherapy cross regimen in esophageal adenocarcinoma. And authors showed that overall survival in intention to treat population should benefit with FLOT regimen compared to cross regimen, with a 3-year overall survival rate with an absolute benefit of 7%. Specifically 57% versus 50%. And this was also confirmed in 5-year overall survival rate. These results are really important as this population of patients, we always wonder which is the best treatment option for this subgroup of patients, and now we have the answer. Although many observations to this trial has to be done, meaning that cross regimen performed a little bit lower than expected compared to the cross trial, and also considering the toxicity profile. However, we do believe that this trial may be practice changing and will help us on shared decision making in our clinical practice. Fortunately enough, research is going very fast in this setting for these patients. So immunotherapy, both in adjuvant and in neoadjuvant setting, and total neoadjuvant treatment, and all different treatment options are under investigation in this setting. So I do believe that for now this is the standard of care, but this may change in the future with new updates and new results coming from the ongoing trials.